Okay, this lady had a cystoscopy 3 months before, and her symptoms didn't resolve, so we are doing a second cystoscopy for her. Now, when we look inside the bladder, look at this bladder. This is there's sometimes after the fulguration calcifications may happen. There are calcifications. These are very irritating, and the deepness of this resection, this is not a fulguration but a resection, is too much. And here these whitish plaques are residual tissues that must be fulgurated. This looks like a biopsy mostly. And here, when we look at the mucosa, we can still see the leukoplakia tissues. Here there are leukoplakia tissues. We will fulgurate these. This fulguration is a biopsy actually. These white plaques have to be fulgurated. And here also there are abnormal tissues. And this is rhetoric orifice here. And these are abnormal tissues here. We can easily scratch these tissues. Look at these tissues. Yes. Yes, and in the ultrasonography before the procedure, we also noticed some white plaque-like tissues in the front wall of the bladder. Here I can see also abnormal tissues spreaded in the front wall. So I will make some fulguration here. Look at these tissues. These are also ill tissues. Look at the membranes. They prevent the bladder from a proper healing. These are healthy parts. In this front wall, it's a little more spread than I expected. Okay, now we are marking our borders. So look at these tissues. We have to go wider. This is previous biopsy site. And get rid of these calcifications. This is really too deep. We don't need to resect this much. completed the procedure. These are the rhetoric orifices. Previous fulguration was here, and now we corrected this place, fulgurated the residual leukoplakius, and the rest of the bladder seems healthy. These are the particles come out, and now we will wash them out like a vacuum cleaner. We take them out like this. Yeah.
Atsana bana onu.
We want to wash the bladder, don't want to leave the infective tissues, embedded infections there. We will wash it a couple of times, but the bladder seems enough healthy. And the front wall, there were some tissues, we fulgurated these two. Let me show the front wall. We fulgurated these parts of the front wall. Okay, this fulguration, she had a fulguration, but it was not enough. We completed this. And this part of the bladder is very important because this part comes into contact with the bladder when the bladder is empty. So when you look from a distance, you can see these parts are healthy, these parts are healthy, but just in the middle, this part which comes into contact with the trigon when the bladder is emptied, this has some inflammation here. We will also fulgurate these parts. Okay, it's okay. We fulgurate this part also, very superficially. I just want the knee mucosa will come over these tissues. Okay, these are the healthy mucosa. It seems enough now. Orifices. Yes, these are not belong to here. I don't want any bleeding spots. Urine has come. Okay, we finished. Okay, this lady came us from a foreign country, and she previously asked me to make a comment about her previous fulguration. And she said she had the fulguration before in her country and sent me the cystoscopy views. It's very difficult to make a comment and to make a decision because I want to trust everyone. It is simple procedure, it can be done, but it is not accepted in the urology world until now. So I was not sure about the procedure that was done to her, so I wanted her to come and let me look inside. In her cystoscopy films, I noticed that there were some areas of improper or insufficient fulguration. So we made the fulguration again, we made the cystoscopy. There were places of untouched places. This was just a biopsy, a very deep biopsy, and this deep biopsy may increase the power, increase the pain during the healing period, and we corrected as much as we can. So after the procedure, we expect a long recovery for all patients, like 3 months, maybe more than 3 months. And nowadays we are collecting our data, and after 3 months, it seems to me 57% success rate at the first 50 ladies. And we are expecting a higher success rate after 6 months, at the results of 6 months. And after 1 year, I think the success rate will be around 70%. Thank you for watching.